Hi everyone, today I will be showing you a video on how to do a sterile dressing for your LVAD, and this dressing is more centered to if a patient is allergic to the chlorahexidine swabs. So instead of the chlorahexidine, you'll be using a VASHE and sterile water. So like all other dressings, you first want to have the patient lay down. It could be a couch, a bed. Again, it wants somewhere where that you won't be disturbed. You won't have any kids or anyone else coming into the room, jumping on the bed or the couch. You don't want any pets or animals. So again, find somewhere quiet that you will be able to perform the dressing change. After that, you want to, if it's a bedside table or something that to do your dressing change on, you want to clean the area. So you're going to take some Lysol wipes, wipe down the area, okay? Make sure there isn't any clutter or anything for that area. You also want to have a trash can close to you because you will be throwing away all the extras, wrappings and everything. You don't want to pile that up on your sterile field. So once this is dry, the items that you will need a sterile dressing kit. You will need the VASHE solution, as well as sterile water, along with some sterile sponges. Now, they could be packaged like this. There is about 2 or 3 in a pack, or you might have a boat, what we call, which has about like 10 gauzes in it. So you want all those near you. And then I will also be demonstrating along with the primer pour dressing if you don't use the sword review. So once you have all that set up, it's time to go to the sink and wash your hands. So I'm gonna head over to my sink over here. You wanna wash your hands, use soap and water, wash them for 2 minutes. Again, you wanna sing that happy birthday, ABCs, so you get that good hand washing. You want to use paper towels. Do not use any bath towels, but usually paper towels that you could throw away, because you don't want to use those bath towels that like build up in pore and different residue. So once we have our hands washed, we will open up the sword review packet. Again, you can open it up like a bag of chips, like I just did, or where the white flap is, you can open it like an envelope. You want to pull out all the items. You could discard the packaging. So you have your 2 masks and 2 bonnets. You want to put a mask on yourself and a mask on the patient. You want to put a little surgical bonnet on the patient as well, and one for yourself. Get your hair all nice and tucked in if you're some ladies or gentlemen with the longer hair. I'm wearing long sleeves today, so if you have any long sleeves on, you want to try to roll those up because you don't want to be having your sleeves drag while you're doing this procedure. Okay, you will next take the sterile gloves. There is a separate video on how to put the sterile gloves on, so please go watch that if you have any questions or concerns. So we're going to put the sterile gloves on. Okay. Right. Pick up in the middle of the sterile packaging and throw away. What will come also is the removal pad. This helps remove the old dressing so it doesn't hurt the patient while you remove it. So we're just going to use this, and you're going to dab just around the border to get this all nice and wet, so when you remove the dressing on the patient, it doesn't hurt them as much. Okay, all at the bottom here. Okay, you want to throw this away? There are 2 ways to take off the dressing. There's a little slit where the pants are, and I will explain the pants in a little bit, or you could take it off at the top of the pants, but there is an indentation that just rips off nice and easily. And there you have the dressing off. Next comes the anchor. You have a girl and boy. You want to pull them up and apart. You want to slip the girl through the boy so that that drive line is unhooked. Lay the drive line nice and gently down, and then you're going to want to take off this anchor. Okay. And the anchor won't be as hard to take off on human skin as it is this Annie. Or a different skin material, as you can see. Okay, once that's all off, you could take off your gloves and throw them away as well. So this is where you'll need an extra pair of gloves. They don't have to be sterile, just what we're going to be doing next is the process of getting all the sponges wet with the sterile water in the VASHE. You just want to put on a regular pair of gloves just to keep everything clean as best you can. If you do use sterile gloves, again, you could watch the video, the sterile glove video, and it will show you how to put them on. Middle, throw away. So what you'll be able to do, you'll have your 3 gauzes packaging. Again, you'll have either a separate packaging like this, or what I call a boat that has about like 10 gauzes in the boat. You want to open up the gauze and lay it flat. Keep the gauze within the packaging and just lay it down flat like that. Again, you're going to open 3 packages. Then lay it flat down. Okay. You're going to take your VASHE, and with the first packet I opened, you're just going to squirt, get that. You want to make sure that it doesn't have, that's fully off first. Then you want to soak that first package of gauze. Get it all nice and wet with the VASHE, okay? Next, you want to take your sterile water, open that up. You want to do the same thing with that second gauze that I opened up. Again, gets this all nice and wet. The third gauze, you're going to want to keep dry. That is for the last rotation of cleaning, okay? So again, you'll take these gloves off, go to the sink and wash your hands again. Okay, like I said before, 2 minutes, soap water, sing happy birthday, sing it loud, sing it proud. It might be someone's birthday, it might be a celebration. Make up a song, but it has to be 2 minutes, okay? Again, wet, dry with paper towels from your wrist up to your fingers, okay? You want to dry and throw away those paper towels. Don't use paper bath towels. This was the sorbet dressing. This is your sterile. You want to open it up. Use the corners to spread away from the table to give you the best space as possible. You will have another sterile gloves in the packet. You're going to put those on. And again, if you have any questions, refer to the sterile glove video. Okay. Again, take from the middle and throw away. So in the store review packet, it reads like a storybook almost. You will want to keep this on the table that I'm showing you for video purposes. It reads like a storybook. You will, since you are allergic to the chlorahexidine, you will not be using these two chlorahexidines, okay? We'll just keep them in the pocket they are in. Instead, we will be going to the gauzes that we already prepped with the VASHE. So we will take it, you want to fold the corners so you're making a little sponge yourself, okay? You're gonna pick it up in the middle. You're gonna go like you would just chlorahexidine, so you wanna press in the center where that driveline exit site is, hold for 10 seconds, and then circle from the inside out, okay? Okay, you want to discard them. During this time, you want to check the driveline, if there's any redness, if it is, you ask the patient if they're having any pain to the driveline site. Is there any drainage coming out of it? You really want to try to, this is the time while you're waiting it to dry, is to see how the driveline exit site is looking. Once it's completely dry, you're going to get the sterile water gauze that you made. Again, you're going to want to do the same thing. Grab all the corners, bring them to the middle, and pick it up like you would, like you're making a sponge. Again, press down right at that driveline exit site, wait 10 seconds, and use the circular motion inward and out, like inward and outward. Okay, use a circle. Again, you want to have that, wait till that's completely dry. Okay, again, this is the time to talk to the patient, see how they're feeling, any chest pain, fevers, chills. Does it hurt them when you press down? Anywhere in their abdominal area. So this is where you could talk to them about that. Again, once that's completely dry, you're going to take your third set of gauze, which is the dry gauze. Again, you'll do the same thing. Bring all the corners together to make a sponge, and you're going to dry it now. Again, go inward and to outward motion. Okay. So next you're going to come back to the store review kit. Because we didn't use the chlorahexidine sponges doesn't mean you throw away the whole kit. You're going to use everything else in the kit. So first thing, or next step, I should say, is the protective alcohol. You are still going to use this. So you're going to take it. I'm not going to do it on the mannequin because it will be harder than I did taking off the dressing. But you are going to bring the alcohol and do a border wipe of where you're going to lay that dressing, okay? And then you'll throw it away. Next, you will take that Silverline. It is in the package. This is the Silverline, and it comes with an alcohol swab. You will open that Silverline up, and you want to wet that Silverline on the white side. You want to make it damp to activate that Silverline. Okay, you see that there's a different coloration, that means it is wet. To put it on the patient, silver to skin, we want to see that white side up, okay? So place it just right in the exit site area, place it right down there. Next, you want to get the Sorbaview or Primapore dressing. If it is the Primapore, you just open up the Primapore, open it up like a book, and place it right on the dressing just like this. If you are a Sorbaview person, you have the window, and this is called the shirt. We call this top dressing the shirt. You want to line up that window with that silver lawn dressing. Place it down. And again, the dressing is like a book too. You want to open it up both ends and line it up with that, the driveline. Okay, I want to make sure it's all nice and tight. Next comes the pants. You want to pull these pants up, straight up, like Steve Urkel wears his pants. Okay, there is a flaps at the each end to open it up like a book as well. So that's, you pull them straight up like Steve Urkel, pull one side down, and then the following side. The final piece is the anchor, which this anchor should be worn all the time. It helps prevent infections. It helps prevent the pulling of the driveline down. So please, please wear this anchor. Again, it has the girl and it has the boy, okay? We'll be using those. So you'll place it anywhere, the patient preference. If the driveline, so you want to place it close to the driveline so you're not tugging on it. There's not, you don't want a lot of tension. So again, it flaps open at the, behind it. Place it on the skin, just like that. Then you'll bring the driveline to the anchor. Place it on top of the anchor, and you want to pull the girl and the boy apart, up and apart from each other. You want to place the girl in the boy and pull tight, so then they're holding hands at the end. And that is it, everyone. Thank you. You could discard your gloves, take your surgical hat off and your mask, and the patient and you are free to go. Thank you so much, guys. Bye.